tray.
Just out with a friend here who came out with me for a fallow buck. So we arranged a fallow buck for him, and we have a fine specimen of a fallow buck here. A good representative of fallow buck for the wild. He's a big carcass size. So I'm going to go through the proper way of checking your carcass and grollicking. The first thing we do when we approach our carcass, as you can see, it's laying still and there's no indication of life. And just to make sure, we touch his eye and there's no reaction. So that's the first thing we do. The next thing we do with our deer is we check it. We just run our hands along it for any lumps, bumps or abnormalities. Everything looks fine. Then we can turn it over and do the opposite side. Just run your hands over it for any lumps, bumps, abnormalities. All the way up along the neck, under the jaw, any swellings or anything. And now we can clearly see that this animal appears healthy. So we'll start our grollock. The first thing we'll do is we'll tilt the animal. And we'll make a cut. That cut there is to bleed him. So the next thing we do, we follow up that cut. Because we're in an area with a lot of coarse, we don't want to make that cut too big. So we pull out the windpipe. He was shot in the neck, so that's cut already. We'll just squeeze out the bullet. Actually, as you can see there, severed the windpipe and the food pipe. So there's not a lot we can do there. So we'll start the grollock. We have the first cut made, and we'll tilt him over here. The first thing we'll do is we'll remove the testes and the pizzle. Simple operation. Make a small cut in, putting our 2 fingers inside the carcass, and we open it. Again, not taking too much here because of the ground we're in, but we have a laneway not too far away, so we'll manage to get him out handy enough and get the vehicle up a good bit of the way. Now we'll come around the other side. What we do next then is reach in on the diaphragm. We sever the diaphragm only on one side. We'll reach in just above the heart, holding the windpipe and food pipe, and we give it a pull, and we're getting everything out. We get all the green offal and the lungs. Everything now is outside. And we reach in, and at the bottom of the fillets there's a little muscle holding that, and we sever that. Everything is outside. All the green offal is outside, everything is outside. Then we just take the diaphragm at the opposite side. You can see the amount of fat on this animal. The fallow haven't started to rut yet, so his meat would be absolutely perfect, and there's loads of fat on him. That fat would quickly disappear if the animal was rutting. So at this point, get all the feces that's in the back passage, and we'll push it down along, making sure none of those pellets go inside our carcass. Then we simply knot off the back passage, preventing any spillage. And there, at this point, we have our deer grollocked. Now we'll do a quick inspection to make sure everything is in order. We have the stomach here, the pancreas, nothing abnormal to see there. We have the liver, no fluke or lines. That liver would actually make a fine pate. We have the heart. Everything seems fine. We'll use the heart. We'll check the lungs. Lungs are all soft and spongy on both sides. We'll go down along. There's the gland at the back of it. No swelling, everything looks normal there. Overall, this is indicating to me that everything is normal with this steer. We can see the kidneys there are coated in a good layer of fat. There's the kidneys. All normal, nothing abnormal there. So everything about this is telling me this steer is in good prime condition and would well satisfy me that it's in good health and it's fit to go into the food chain. So now the only job that's left is we have to extract the animal, which it's only about 150 yards, but I've kept this and I have nothing, so we have a clean drag between the two of us and it'll be perfect. But a fine example of a fallow buck. What I'll do when I get back to the vehicle, I'll remove the bung. And I might do that when I get back to the vehicle, just to remove the bung. I don't remove it here because we'll get too much contamination dragging it across the course. So next is the extraction.